I'm Robert Constant. I'm a clinical endocrinologist at the Diabetes and Endocrine Center of Orlando. I'm a hormone specialist as an endocrinologist, and one of my areas of great interest is in thyroid disease. I've often been asked by patients, and I also lecture commonly on the different types of thyroid disease that there are. One of the most common thyroid diseases is primary hypothyroidism, or an underactive thyroid. Interestingly, an underactive thyroid is a type of disease where if a patient is being followed appropriately, the physician may be aware of the fact that the patient has hypothyroidism before they even do. The testing that we do is extremely sensitive, and it can very often identify the disease even before the patient begins to have symptoms. It is not uncommon, however, for patients to actually come to their doctor with a constellation of symptoms for which we then diagnose thyroid disease. And the common symptoms that we look for are typically a patient with cold intolerance, a patient who basically feels like they're colder than their peers all the time. Everybody else is comfortable in the room, they feel cold. This is particularly important if they notice that this is different than their own personal norm. All of us has a certain set point for how we feel about different temperatures, and if that changes dramatically, that could clearly signal an underactive thyroid. These patients will also note problems with fatigue. Fatigue is a common problem that we see in primary hypothyroidism. It's a very non-specific symptom. There are many, many different kinds of problems that can cause fatigue, but thyroid is certainly one of the foremost among them. We'll also note that patients can have slower heart rate, maybe a slightly lower blood pressure. They could have problems with constipation. They could notice dry skin, dry hair. These are the symptoms that we commonly see in patients who have primary hypothyroidism, particularly when these symptoms are seen together or as a collection of symptoms. Then they're something that really point us to looking toward thyroid as a possible etiology.